So we're here today to take a look at the OhioHealth MS Neuroscience Clinic, and I, Stuart Schlossman of MS Views and News, wanted to be here with Dr. Boster for him to give us a video tour of this facility and be able to show the great state of Ohio, you know, all that you have to offer.
Thanks for coming, Stuart. I'm delighted to have you visit, and it'll be kind of fun to show you how we take care of MS patients and their families. The mission that drove the design is comprehensive, interdisciplinary, longitudinal, patient and family focused care. And so what I'm going to show you is sort of built with that idea, and it starts when you come in. So that's free valet parking. That's very important, I think. And the distance from the front door to here is about 200 feet, and that was done on purpose. I've worked in environments where patients were asked to park and walk blocks. That's not fair if you have difficulty with ambulation. And so I think it's meaningful just to bring someone in.
So do they have to pay for valet?
No, it's free.
Totally free.
Yeah.
Awesome.
The space in here, I love this lobby. I had a husband once tell me that if I put a coffee maker in here, he'd never leave. And it doesn't feel stuffy. It doesn't feel like you're in a box. And so I notice families don't mind if they're out here and they talk, and it's kind of cool. So I want to bring you in here and I'll show you the center.
Great. All right, so tell me about this. I see all these multiple rooms. I see this wall, which we didn't really get to see either. We'll see the big one later.
This hallway constitutes where we do the bulk of MS care. There was a lot of thought given to the experience, and so I want to show you sort of how we structure things from the standpoint of a patient.
Right.
We have dedicated MAs that only do MS, and when the patient comes in, the first thing that happens is they go through what we jokingly call the MS Olympics. And so this is our version of the MS functional composite, where every patient has a 9-hole peg test, a timed 25-foot walk, a low contrast visual acuity, and a symbol digit modality. So you're catching arm function, gait and leg function. You're catching low contrast acuity is a more sensitive way to pick up subtle optic neuritis deficits. And then the symbol digit modality is a cognitive screen that we do. Yeah, the symbol digit modality,
Yeah,
I would love to.
Can you show me that?
I would love to. This is the symbol digit modality, and it's a matching quiz. So up at the top you have a bunch of numbers and symbols, and there's a period where you practice. Now when you start, you're told to just fill in all the numbers that you can, and you're given 90 seconds to do it. Now this cognitive test really focuses on working memory, speed, and a bunch of things that are essentially frontal lobe function. It's very, very sensitive to pick up cognitive deficits in MS, and it takes 90 seconds to do.
So how often does somebody actually complete this form in 90 seconds?
We have had one patient in the last 7 years complete the entire thing.
I could not see getting through 2 lines.
A score of 42 is a normal value.
Right.
And a 20% change we find clinically significant. It takes 90 seconds to do. And so it's a very excellent way of screening. This doesn't replace more in-depth testing, but it'll cue us in that something's not right.
So this is one of the many things that people do when they first come in each day.
That's exactly right. So every patient, every visit goes through that battery of testing. Our MAs ask about medicines and collect vital signs and then room the patient. And I want to take you down and show you a room.
How many MAs do you have here at a time?
So it's flexed based on our needs. So we can have 3 to 4 MAs and 2 nurses based on the number of providers. Okay. And they're all specialized in MS, and they can all kind of function in those different roles. It's really kind of awesome.
Great. Okay, next step. So this seems very low.
So this room was created for a couple purposes. This is really like my house. This is where we talk. This is where we diagnose. This is where we fight. This is where we figure things out. And this is where we do procedures. This table is adjustable because some of my patients have trouble getting on and off a table. And so that's really helpful. We can also set this up to do a lumbar puncture procedure if we need to. There's space for a wheelchair. There's space for a family. And it's a nice environment, I think. We use an electronic medical record, but that's not the highlight of the room. This is a place where I hope people feel comfortable talking to me, and I can talk to them.
And they basically stay here for the whole appointment.
Yes.
And that's what you're going to show me next.
Exactly.
Great. Start that again. So people are in here all day long, so tell me what this scale is of how you get the care.
when I mentioned interdisciplinary and comprehensive and patient-focused, I think it's really born out of this funny flag system that I'll explain to you. The patient has the special intake work by our medical assistants, and they're roomed. They're seen about every 3 months. One visit will be with a fellowship-trained MS doctor, and that'll be a half-an-hour visit. 3 months later, they'll see one of our specialized nurse practitioners, and that's actually a 45-minute visit to provide a little bit more in-depth time. When we see the patient and we're done, their visit starts. So after that time frame, depending on the needs of the patient, we can bring the resources they need to the room. So I'll give you an example of a patient that we met them and we're working on DMT and symptomatic management, but during the course of the discussion, we found out that the right hand's clumsy. Right. We also find out that the spouse is not being as supportive as they need, and they have an issue with their boss at work. They express an interest in a potential clinical trial, and by the way, they have a question about one of their infusions. So when I leave the room, I say, okay, I need to get labs and I want a urinalysis, by the way, but I also need occupational therapy, I need social work, I need a clinical trial coordinator and an infusion coordinator. And then I flip the appropriate flags and I move on to the next patient. We have a nurse navigator who has a very special role in clinic. She mans these 12 rooms and coordinates for the patient's need. The patient stays there.
You have 12 rooms just like this.
Correct. So she'll call the social worker who will come to the room and go into the patient. And they're going to sort out what's going on with the spouse. Maybe they invite the family to come to a patients and partners support group. Maybe we provide some local resources. We talk about the issues that they have at work. We discuss FMLA and other issues related to work and give them resources. And then she's done. Great. So next, the nurse navigator is going to call in the occupational therapist. And so the OT is going to come in, and they're going to work on hand function. They're going to assess the patient, and it's a free screening. They're going to give the patient exercises, and if deemed appropriate, we'll refer them to occupational therapy formally. And so that way, patients aren't missed. You think about it, if I said, hey, Stuart, I'm going to send you to occupational therapy, your immediate thought is, that's another day off work. And you may meet the occupational therapist with your day off work, and they just give you some putty, and you think, really? So we bring the occupational therapist to the patient. In a similar fashion, the clinical trial coordinator and the infusion coordinator will come. And when all the flags are dropped, the nurse navigator will collect all the information, make sure that they have their urinalysis and their labs done, and then escort the patient out. I may see the patient for half an hour. They may be here anywhere from 45 minutes to 4 hours based on what they need that day. And so we can't predict what someone's going to need when they come in. We can be ready and flexible. And I have to tell you that since we started doing this, it's the most fun I've had taking care of MS patients in my career.
Is PT handled in this room as well?
Yes. So we can bring at a flag neurophysical therapy, neurooccupational therapy. Speech pathology will come to the room both to do cognitive screens and swallowing. We can bring a social worker, clinical trial coordinator, infusion specialist, billing specialist, even a registered dietitian. We also do our bladder scans in the room. We have capability of doing OCT down the hallway, EKGs when we need them. And of course, our laboratory is right in our lobby. And so again, we're trying to create a comprehensive packaged process for the patient so that we come to them and they leave here feeling better than when they came in.
And you have MRI here as well.
We do. We have a gorgeous 3T Siemens machine, which is directly below us. I tell people it's like we put a jet fighter plane right below us. And we have a very nice reciprocal relationship with our radiology colleagues. And to the extent that if we need an urgent scan the same day, we can get it most of the time. We have patients that occasionally will travel from a far distance, and our standard practice is you arrive, get scanned, we see you the same day. But sometimes you weren't planned for a scan and we need one, and so we have the capability of doing that.
So Dr. Boster, if somebody's being scanned, they have this MRI downstairs, and do you often have the patient come back up then to review the scan with them afterwards?
Always.
And is it then automatically just sent up as well?
So the scans, the second they're done, they're available for me to review. And our standard practice is get the scan, have a cup of coffee, you have a clinic appointment that's scheduled, bundled, and then when you're here, we go over the scan together. Now, our neuroradiologists are highly trained and they put out excellent reports, although we are too. And so we look at the scan with the patient in almost real time. And I think that's appropriate because I don't think it's a good idea to make a patient wait.
They just spent a lot of insurance money and they just went through something which is a little rough, and it's meaningful because if we see new activity, we're going to have to move, and they know that. And so I don't want to make them wait during that process.
Great. Okay, let's see what else you got in this wonderful facility. So I see that you have an OCT room, and you know, I know what it is, and there might be others out there, but can you explain what OCT is and tell us about this fabulous machine?
I would love to. So this is kind of bragging rights. So we have a Zeiss OCT, which is a really high-end machine that gives us a very special output. OCT stands for Ocular Coherence Tomography, and it's a non-invasive way of measuring the retinal nerve fiber layer. So that's a lot of words for the back of the eye. This is actually part of the central nervous system. It's mostly gray matter, and interestingly, it correlates with a lot of really important stuff in MS. So drop in OCT, of course, correlates with visual difficulties, but more than that, it correlates with MRI atrophy, and it correlates with disability on exam. We're not at the point just yet where independent with an OCT, we can make a treatment decision. But it is a critical piece of information as I try to put the situation together. And I think that we are quite literally on the cusp of actually making clinical decisions based on this information. Tracking someone, for example, that has an optic neuritis, we can look at how they recover. I'll give you another example. Someone has their first event, which is an optic neuritis. The OCT can give us insight. Does this look more like MS or does it look like NMO? That's pretty special. And so we routinely scan patients with the OCT machine at least once a year and look for change.
And NMO is DeVix.
That's right, DeVix disease, neuromyelitis optica. Now the test itself is painless. It's 3 minutes per eye, and when we time it, about 10 minutes from the time you sit down to when you stand up.
What are they seeing when they're looking at this machine?
They're looking at a screen, and there's a laser that is shined straight ahead, and then they just look straight and then it scans. And it takes myriad pictures and puts them together really fast and gives a printed readout, which we can then review with the patient.
So it's almost like an MRI of the eye.
It is almost like an MRI with the eye. It's complementary information to the MRI, and it's really cutting edge as far as next steps in MS diagnostics.
Great.
Down here, I want to just call out one other room.
Okay, so we're at your research. Are you ready?
Yep.
Okay, we're at your research room. Could you tell me what you have going on in here and what kind of research you're involved with?
Absolutely. Just to show you real quick, these are real live clinical trial coordinators in their own environment. And they're working right in the clinic space, and I want to explain why. So MS research is very important, and we need to be doing research so that we can understand the field better and find better treatments, look for cures, do better diagnostics, etc. But if you think about it from a patient-centric perspective, it's the chef's menu. Some patients, they want to treat their disease. Other patients, they want to go beyond that, and they want to fight back, and they want to stick it to the disease. And that's an opportunity. It's a special opportunity, because if it wasn't for patients who are willing to participate in research, we would have no therapies. And so it is a critical thing which needs to be honored. Now, I'm a firm believer that the experience for the patient in a trial should only be enhancing what they already get. Our clinical trial office is in our clinic for a reason, because for the patient, it needs to feel just like a normal clinic visit. We're still taking care of them. I'm still their doctor. They're still my patient. They're still in the same center. We just happen to be treating them in the context of a clinical trial.
How many patients do you believe you have in clinical trials right now?
Right now, we have probably 50, 40 some patients. And we try to maintain trials across the spectrum of MS disease state if we can. That way we're looking at something for someone with progression. We're looking for something for someone who has relapsing MS. We're looking for something where someone has clinically isolated syndrome. We also do a little bit of research studies looking at spasticity and the like, because it's one of our clinical interests. But again, the point is that we want to bring this opportunity to the patient. Whether the patient wants to do it is up to the patient, but I'm proud to offer it to them. And I think it's not a good idea to have your research unit way, way far away where you say, okay, well, we'll have them call you. That's not the right thing to do. And so we bring the research to the patient, and I feel good about that.
Good.
Come on down this way. So
it's odd. Are we ready?
Yep.
Okay, so it's odd for me to see a pharmacy inside an MS center. And so can you tell me the reason why you have this here?
yeah, we've entered into our infusion part of the clinic. And so again, in the spirit of keeping the patient in one location, our infusion operation is part of our clinic operation. Now, we are in the first floor of a hospital, and that affords us an opportunity to have a pharmacy. It's a really cool thing. Our pharmacists are team members, and they're intimately involved in our ordering of drugs, checking drugs, making sure things are okay. And when there's a problem, having a clinical pharmacist at the ready is a godsend. I'll give you an example of a patient that we had who has an intrathecal baclofen pump and was going through active baclofen withdrawal. We didn't know that was going to happen. We were working on him in there, and I needed IV Valium now. If I was working in a strip mall, that wouldn't happen. I called for it. The pharmacist brought it to me immediately. It was really, really special.
Great.
So I love having them here. I want to show you the infusion
It's like a little
center.
mini hospital.
Yeah.
Yeah.
Come on this way. I'm going to show you an infusion room. So this center was really influenced by some patient experiences that I had. I had a young man that I take care of that was a poster child to an infused treatment. Once a month he would come and get this treatment, and for 2 years his disease was quiet, and it was awesome. And he came to me one day in clinic and he said, "Aaron, I can't do that therapy anymore." And I thought, "Why not? You're responding." And he said, "Because I feel horrible. I feel like a sick cancer patient. You stick me in a little chair and there's a bunch of people next to me and you push up my sleeve, I have a band on, you spike my vein. I don't want that experience any longer." And so we had to stop. That influenced how we designed this. And so let me show you what we did in response to that experience.
So we're now here to visit the infusion center area, and Dr. Boster is going to explain all of this to us.
But to do it right, I need you to sit down.
You need
so
me to
come
sit
make
down.
yourself comfortable. We have to take a second to get situated here. So this experience is intended to be a different experience than what we typically see in an infusion center. These bays are essentially private. Now, if you're a social butterfly, we can open up this door to your neighbor. But if you would rather be by yourself, we can do that, and we can close that. The lighting was thoughtful, and the cable TV is just for you, and we have Wi-Fi in here. We bring in volunteer therapy dogs most days, and if you want to have your family here, we have space for that. Our goal is, if you have to be infused, you should walk away feeling better than when you came in. And when a patient tells me, "This is the best part of my month, I have a nice nap and no one can bother me," I kind of like that.
That's right.
And so this was our response to an uncomfortable patient experience. And my hope is that it enriches the patient. And it's right here in clinic. You know, the other advantage is that because infusion is in clinic, we walk through here all day long and we see our patients. And so I might only see you once every 3 months, but I see you, if you're coming monthly, all the time.
Do you do both sets of infusions, both infusion therapies in these rooms?
We do a lot of different infusion therapies. So we infuse natalizumab, we infuse rituximab, we infuse alemtuzumab, we infuse IVIG, cyclophosphamide, IV methylprednisolone. We also have protocols for headaches because, as you know, MS patients are prone to have headaches more commonly than the general population. And so we can give IV Depakote and magnesium and the like.
Great. Thank you very much.
Let me show you something down the hall.
Okay. So I noticed that you have areas here that the rooms appear wider. I see that at least that the screens look wider than where we were on the other side. Can you tell me why?
Absolutely. Now, these rooms are in use, and so I can't open the drape. But these rooms are special. I had an experience with a patient, one of our patients, that needed rituximab. They were on a gurney in a bed, and we couldn't infuse them because we couldn't fit the bed into the infusion center. So never again. These are 2 very large infusion bays which can accommodate a gurneyed patient. And that way we turn no one away. And I think that's very special.
Great.
Come on down the hall, I want to
Good
show you
idea.
some more stuff.
Good idea. It's funny. So tell me about your rehabilitation services, please.
As we talked about earlier, we have physical therapy, which is neuro-PT, occupational therapy, and speech pathology on site in the clinic. We also have a PT gym. Now, this is not a fully comprehensive gym, and most of the needs of the patient are met in the room. But if they want to do a little bit of therapy, or they have a hitch in their giddy-up and they need a special table or a device, we have them here. And so I think it's a nice addition to what we offer, and it really allows the PTs and the OTs to extend their reach right here in clinic.
Great.
Now, across the hall is our social work office, and our social workers come into the rooms, of course, but they need their own office space. And this is where they can help with seeing a patient off cycle. So a patient will call and make an appointment to sit with them to talk about an issue that they're having, or an issue with coordination of care, or to do some counseling. And I think, again, this is a really special addition to what we offer. I want to show you something around the corner.
Before that, question, does social worker take care of families, caregivers?
Of course they do. You don't have MS by yourself. Your family has MS, and it takes a village to take care of a patient. And it's a fool who thinks that caring for the family is time poorly spent. We do a lot of work with caregivers, and there's a lot of need for that. And so when a patient comes, their spouse comes, and the social workers have developed resources for the spouse. For example, we do a support group once a month called Patients and Partners, and it's a really neat support group. Patients and their loved ones come, and when you're sitting in a room and you share something going on with your loved one, everyone in the room's shaking their head because they all have the same experience. And so that's a very, very neat thing. I'm really, really glad that we have that.
Great. Dr. Boster, last night when we were doing our program, many people were speaking about your wellness program.
Yeah.
Can you please tell me about that?
I would love to.
Great.
So we think that there's an unmet need in MS. And that unmet need has to do with wellness and being in shape and being healthy. And you can tell an MS patient the critical importance of exercise. And in fact, we're learning that it's more important to MS than we ever realized. But then sending the MS patient out to go get in shape is sometimes sending them out for failure. They go to a retail gym with a personal trainer that doesn't know MS, that doesn't understand heat sensitivity, motor fatigue, balance issues. These are very, very real things. And they can make a patient leave a gym and never go back. And so we are piloting several different projects, MS-specific wellness. For example, the one that I'm most excited about is a pilot that starts next month, where we're bringing patients in to do group exercise. Twice a week, they're going to meet with a neurophysical therapist. And the sessions are about an hour long. There's about 10 minutes of education where we bring in a registered dietitian or somebody to teach them. And then there's 4 sessions like curves. And so one thing that we'll look at is strength, because we feel like strengthening the core and the legs is a really important thing. Then they'll move on to flexibility and stretching and learn how to do that properly and have practice in doing that.
And it's great that they're working with other people there with them.
That's exactly
Doesn't
right.
get bored.
No, that's exactly right. And so we rotate, and then they go after they've done strengthening and stretching, and they're going to do cardiovascular endurance on a bike.
Right.
And lastly, we're going to work on balance. And they do that twice a week, and then there's homework to do it once on your own.
Right.
Our goal, our vision, is to offer this every 3 months. They're 3 months programs. And to be able to offer a program for folks that are in a chair, a program for folks that have an assistance device like a walker or a or a scooter, something of that sort, and then folks that are ambulatory without assistance. And I really think that it captures this unmet need and helps people address and embrace wellness, which I think results in better care.
Absolutely. Thank you.
Come over here.
What's next? So this looks very interesting, and I've seen this in a few places around your clinic. You have a really large one on the other side, and so can you explain what this interesting information is about?
Yes, I can. The OhioHealth system is owned by the Methodist Church. And I got to tell you, as a Jewish boy coming to work here, I was a little bit nervous about what that meant. And this makes me feel so good. This is a wall of hope. And what you see here written in multiple different languages, representing multiple different religions, are messages of hope. This is how we translate religion and spirituality into our presence. And I think it's a really, really nice reminder. And so I look at that, kind of makes me smile.
Great. So, so as an MA, Amber, for OhioHealth, I heard that there's you plus 3 others seeing MS patients. And what is the role of an MA with the MS patients?
The role of the MA for MS patients is we will greet the patient, we'll bring them back to the room, we'll do their walking, their testing in the rooms with them, answer any questions, review their medications, we'll take their phone calls, prescription refills, we do paperwork for them, prior authorizations, orders that need to be done, we'll make sure that they're in there for them.
Okay, so basically you go over and where Dr. Boster showed us the little thing on the outside of the room, you're one of the persons that completes the square that's outside there, or you're there before the neurologist goes in?
We're in the room first before the neurologist goes in, and then we'll mark when we are completed, and then we'll flag for the provider. We'll let them know that they're ready to go in there. Then when they are done, they mark if labs are needed, if there's OCTs or funduses that needs to be done, any kind of testing, and then we'll do the testing for them.
Right. As an MA, are you allowed to prescribe medications?
No.
Okay. All right. So what else do you do for the patient, or is it just all the technical at the beginning?
We just do a lot of the patient care, their needs. We get what they need.
Yeah. Do you get them very relaxed?
We
for
do.
their-
Yeah.
Yes.
Yeah. We get very close and personal with our patients. So
Great.
some of us know how we are and how they are. We ask about their families, how they've been doing, vacations.
I'm sure that
yeah.
the patients very much appreciate all the MAs that they can to come into the rooms and see them.
Well, thank you.
So thank you very much for speaking with us today.
Yeah. Thank you.